In the midst of an opioid crisis, Suboxone is a medication used as a treatment for addiction to heroin and other opiates. The medication, which contains both buprenorphine and naloxone, comes in both a sublingual pill and film form. Buprenorphine acts as a partial agonist which attaches to the receptors in the brain and stops the effects of the drugs. Naloxone is added to buprenorphine to combat opiate withdrawal symptoms. It is also added to lessen the likelihood of Suboxone being broken down and injected. If this is attempted, the user will likely go into immediate opioid withdrawal. Suboxone is meant to be administered under the supervision of a physician and used as part of a treatment plan that also includes counseling and other behavioral therapy. The film is available in 4 dosage strengths and is meant to be taken by placing under the tongue or in the cheek. It has quickly become an essential part in successful recovery by helping people overcome the hurdles that are withdrawal and drug cravings. Once your physician decides on the right dosage, the choice of pill or film form of Suboxone is decided. If your doctor prescribes sublingual film, you can take it by holding it on its edges and placing it under your tongue near the base. If instructed to take 2 or more films, you will place the film on both sides under the tongue instead of in the middle. If taking the film on the inside of the cheek, also known as buccal administration, you will hold the film on the outside edges and place the film on the inside of your cheek. If instructed to take 2 or more sublingual film, you will be instructed to place the strips on both sides of the cheek. While waiting for the film to dissolve, you should avoid talking because it may affect how well the medicine is absorbed. Also, chewing or swallowing the film before it is completely dissolved may cause the medication to not absorb properly. If a dose of Suboxone is missed, take the medicine as soon as you remember, unless it is close to the time of your next dose, in which case you would skip the missed dose and continue taking the medication as prescribed. Do not take 2 films at once unless instructed to do so. Always check with your doctor if you have any questions about doses. If you are taking the sublingual pill, do not crush, chew, or swallow it. You will place the pill under your tongue and allow it to dissolve. If instructed to take more than 1 pill at a time, do so by placing each pill under a different part of the tongue. Do not eat or drink until the pill is completely dissolved. The pills take 4 minutes to dissolve, while the film takes 3 minutes. Drinking water before taking the medication will help the medicine dissolve quickly. As opioid addiction became more and more of a problem for people, Suboxone was also created in sublingual tablets. However, not long after came the problem of diversion and misuse of the tablets, as well as the concerns of the unintended exposure to children. The sublingual films were introduced to address those concerns. Due to the sometimes euphoric effects of buprenorphine, typically in people not dependent on opiates, there may be a desire to abuse the medication. The lack of access to treatment also creates the demand for diversion. Suboxone often is administered in an office setting under the supervision of a physician to limit the frequency of misuse of the drug. The quicker dissolving time of the film is beneficial as it typically dissolves 1 minute faster than the pill. Another key difference between the film and pills is that a partially dissolved pill can still be removed from the mouth, while the film quickly becomes unable to be removed once administered. A good thing about the film is that each individual package has its own 10-digit code, which allows for better tracking and discouraging diversion. If a patient is being transitioned from the pill form to the film, there are not many differences. The conversion ratio for up to 4 milligrams is 1:1. This means the bioavailability is the same and no necessary dosage changes are required. Alternatively, the reported bioavailability of the 8 milligram and higher doses of film is higher than that in the tablets. A lower dose may be required when switching from the tablets to the films in these cases. Suboxone was a great discovery for those who are looking to recover from opioid use disorders. For many years, methadone was the only medication-assisted treatment option. But with the introduction of buprenorphine as a treatment option, the access to treatment has been significantly increased. Unlike methadone, which can only be distributed in a highly structured clinic, Suboxone is allowed to be dispensed in a physician's office or other settings. This makes Suboxone more appealing to those unable to access a methadone clinic or who would prefer to receive treatment elsewhere. Buprenorphine is also available in an implant. The implant has been created for those who worry about taking their medication every day or possibly losing it. A small implant is placed under your skin in the upper part of your arm. This can be done at your doctor's office or similar settings by those qualified to do so. The implant releases buprenorphine into your body for 6 months. After the 6 months, the implant is removed. A need for another implant will be assessed by you and your doctor. We hope that you found this video helpful and informative. On behalf of Find Suboxone Near Me, thank you for watching.